Hey guys, I'm going to put this clip at the beginning of each area of care video, which is going to follow. So if you've already seen this clip, then skip past it. I will put the time marker down below as to when this bit of me talking is over with. So I used RobsReview, robbiewolf.com, link is down below, to study for and pass with flying colors my CPNE, which is part of the Excelsior LPN to RN Bridge program. It's the clinical big bad scary test. And it is big bad and scary. But I made a video of each area of care because that's my study technique. I made the video so that I could press play and practice the area of care while the video was going on beside me on my computer. Now, because you have to purchase RobsReview program, I can't give out any information that is proprietary to him. So there will be times in this video where I will blur something, I might cut something out, and all that's going to be left is the motions that you would do when you're doing the area of care correctly without using his mnemonics. Now, his mnemonics are awesome, so I highly suggest that you go onto his website and you purchase the program. It will be worth it. You do not want to fly to wherever, spend thousands of dollars for the test itself, get your hopes and dreams up, and then fail and have to come back and tell your family that you failed. So it's worth putting a bit of money out there to pass it. So for all of his mnemonics and all of his tips and hints and great teachings, get his program. But what I'm going to be showing you now is how to do each area of care going through the motions. Now, there's a few videos which I made which I won't be able to put up here because I put the mnemonics across the screen for each thing, and so that is proprietary to him, so I will just not be able to show those videos. So if there's a few AOCs that are not posted here on my channel, then that's why. So what I do post up here, I hope that you enjoy it. I hope it's useful to you. And if you're absolutely dying to see an AOC performed that I don't end up posting, then send me a message and let me know. But there are other YouTube videos out there showing how to do different AOCs. So I won't make any promises that I will post any additional videos past the ones that I'm about to post, but if I get enough requests, then I might succumb. So enjoy the video. Abdominal assessment. The mnemonic for this is so let's start with coming into the room. Knock, knock, knock. Hello. So before I do anything, I'm just going to wash my hands. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Wet cloth, dry cloth, alcohol. Okay, now I'm just going to check your ID band with my records here. So I see that you're Alicia Keys, 2480, 241980. Great, I have the right person. And my name is Lita Rayner. I'm an Excelsior College nursing student, and this is my clinical examiner, Amber. And I want to thank you for letting me do this with you. Alicia, how would you like me to call you? Alicia's fine. Okay, alright, very good. I'm just going to do an abdominal assessment on you right now. But before I do you need to go to the bathroom before I'm like pushing on your tummy? No, it's okay. Alright. And do you know of any pain that you have in your stomach? because if you do, then I'll be pushing on the area a lot lighter or softer. My right lower side hurts. Okay, alright, so like right about in this area. Yeah, okay, so I will be careful with that area then when I'm touching your tummy. Okay, and then I'm going to position you. So I'm going to have you lay all the way back, and then we're going to have your knees flexed. If you are on tube feeding, we're only going to go down 30 to 45 degrees. Alright, and the last thing I'm going to do is give some privacy. Curtain. So I'm just going to look at your tummy. And then also looking at the appearance. I see that you have a little red spot right over here. Okay, nothing else. So I'm just going to write down flat, red, left upper quadrant. Okay, just to remind myself. And then I'm going to listen next in the 4 areas of your tummy. So, but before I listen, I know you have this suction going. I'm going to turn the suction off just while I'm listening, and then I'm going to put it back on, because if it's still going, I won't be able to hear your actual sounds, okay? So because that's probably a clean area back there, I'm going to alcohol up. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. I'm going to get a glove on my right hand that I'm going to use to touch the switch, and click. I'm going to turn it off, take my glove off, throw it in the garbage, and then I'm going to listen. And if I have any trouble hearing any sounds, I'm going to listen for a full 60 seconds. So if it takes some time, then that's why, okay? So I'm going to listen. I'm not going to push during this. It's just going to be just on the top of your skin. So I'm listening. I hear sounds. Listening, I hear sounds. Listening, I hear sounds. Listening, I hear sounds. Okay, very good. So now that I've listened, I'm going to turn your suction back on. So let me alcohol up. And get a glove on. And click, turn it back on. Okay, and that suction is going at the rate it's supposed to be going, according to the MAR. Lastly, I'm going to feel, and since you told me that you have pain in the right lower area, is that right about here? Okay, so I'm going to push on that area last, okay? Alright, so let me feel here. I don't feel any masses, anything obvious there. Feel there, and okay. So as I touch this, you know that pain scale that everyone asks you about, 0 to 10. 0 is no pain and 10 is screaming and crying, right? So I'm going to push this gently, and then after I push it, I'm going to ask you to tell me what your pain level was when I was touching it, okay? So I'm going to push nice and gently. I'm going to put a little bit of pressure on it. Tell me if you want me to stop, okay? Alright, Yeah, I don't feel any obvious masses or anything there. Alright. What was your pain level during that? 4. Okay. Okay, so now I'm going to make sure I did. Okay, very good. So, how did that abdominal assessment feel to you? It was okay. Okay, all right. So thank you very much. I see that you're safe. Your bed is low. Your side rails are up, and your call light is right there. Very good. And you know how to push that call light button if you need anything, right? Yes. Okay, very good. So at this point, I'm either going to continue on to another AOC, or I'm going to leave the room. And now I'm going to say thank you. And alcohol. And clean my hands. And leave the room. If it's 2 to 3 sounds per second, then it's hyperactive. Or if it's more than 30 per minute, it's hyperactive. If it's 1 sound every 5 to 15 seconds, that's active. If it's less than 5 sounds per minute, it's hypoactive.